We continue with our coverage of the health sector crisis, and the Health Ombudsman, Malegapuru Makgoba, has warned the Department of Health is headed for disaster if the constitution isn't changed. South African Medical Association Chairperson Mzukisi Grootboom is in our Durban studios and joins me now. Thank you so much for coming through, Mr. Grootboom. It's collapsing. Those are the ominous words that were uttered by Malegapuru Makgoba in response to a question about what is the state of our healthcare in the country, public healthcare. Do you share that sentiment?
Good evening and thanks for having me. I'm sitting here greatly concerned about what I know, what I've observed, and what was said last night. What was said is a confirmation of the impression we in the Medical Association have had. And despite the denials and despite of what is being said by the powers that be.
So from where you sit, the health system, the public health system is collapsing?
Where I sit, the public health system is now in high care. It's just about to go to the ICU. Until and unless something is done, South Africans need to realize that here is an asset that we are about to lose whilst we're sitting and doing nothing about it.
So what ails our public health system? What are the symptoms you've observed over a period of time that have led you to this almost depressing conclusion that we really are in trouble in the public health sector?
Something that was mentioned at the final assessment done by Judge Museneka at the Esidimeni arbitration hearings. He made a very pertinent point to say that there is literally a collapse of systems. And this does not only pertain to Gauteng. It is something we observe across the healthcare system in this country. Despite the aims and the lofty preparations we're making for us to achieve a universal health coverage, which in fact we agree this country needs. But we're not, unfortunately, making it easier for us to achieve that noble goal.
So please unpack for me then, what does this literal collapse of systems, how does it manifest? What happens at hospitals where your members work, the South African Medical Association members work? What are some of the actual practical manifestations? It ranges from collapse of the actual infrastructure. I'm talking here about where it's mentioned that some theaters, the roofs are falling, there's water coming through. In some instances, there's no water or even warm water. Generators are not working. There's drug stockouts. X-ray machines are not working. Oncology machines are not working. There's no money available to pay doctors or even employ young doctors who've just qualified. It ranges from across the board on issues like that. About a month ago, I was made aware about a hospital, very important hospital that is caring for people in the East Rand, where it was said the hospital had unfortunately had to be closed. The question I ask is why? When such a facility is important to serve the people in Benoni and Boksburg. I was told that it has become a danger to the people and the users of the healthcare system in that particular institution. The question then I ask is, how do you get to that stage when in fact we have been told that there is a re-engineering of this, that, and the other, and we are trying to upgrade the facilities to make sure that they are responsive and they are ready for the implementation of the NHI. We've also been recently, some of your colleagues, one of your colleagues has interviewed members of the Medical Association where they're saying, I've been aware that it's only junior doctors who have a problem of being employed. I am now being informed that it's difficult to get employment even for specialists, and the specialists who've just been trained. About 2 months ago, there was a circular from the health department in Gauteng saying that all the posts where there's natural attrition, in other words, people who have got to leave the system because of aging and going on pension, those posts are not going to be replaced. We've also had reports of certain institutions where our members, because of the shortage, are doing what is the authorities say an overtime that is unnecessary. In other words, they are doing overtime beyond the norms. Why are they doing this? They are doing this because of the situation they find themselves where there is shortage and the workload remains the same or is increased in some situations. There is therefore no financial resources to be able to deal with those challenges,
right,
including other challenges that I've mentioned.
Right, Mr. Grootboom, just a final one then. Where should ultimate responsibility and accountability lie? Because, I mean, we are in a unique situation in as far as the health system is concerned, in that it's a national function, but it's devolved to provinces with some of the functions being performed, and authority vesting with provinces and even down to the level of municipalities. How much responsibility should the Minister of Health, for example, take for this particular situation? Because ultimately, he coordinates the implementation of our health policies and ensuring the overall health of this particular sector.
I would like to say that the issue of Section 100 of the Constitution has now become an issue that has been used as an excuse. The problem, say, relies on the leadership that we have who are running this country. You need to realize one thing, that these are people we have entrusted to run this country. We gave them a huge mandate to be able to deliver the services to our people. And it is a challenge that requires the whole nation to occupy itself with. And this needs an urgent colloquium. It must be organized by the highest office in the land, which is the presidency. We cannot rely on any province. We cannot rely on any government department to take care of this matter. This matter requires, this is a national crisis, and we are appealing as doctors in this country that the highest office in the land needs to apply itself and actually call together all stakeholders for us to map a way forward and also address the issues that are facing us. We also like to caution that a task team, as we have been doing, task teams that we have been deciding to use to address some of these complaints are no longer going to help, because, for one thing, we had these challenges for the last 3 years. This is a cancer that has been growing for the last 3 years, since 2015. When we highlighted these problems, there was a task team comprising of very highly qualified administrators, professors of medicine who went around the provinces. Alas, the South African Medical Association has never been made privy to the findings of that particular task team. Recently, when we had problems in KwaZulu-Natal with the oncology crisis, another one of those gentlemen was sent down to come and speak to us. And all we are asking for is literally nothing high-powered. We are saying that we need the minimum facilities to be able to work and make sure that our patients have got access to quality health care.
All right, thank you so much.
We've defined what we mean by quality. We said minimum available.
Thank you so much. That is Mzukisi Grootboom, who is the chairperson of the South African Medical Association, not mincing his words, saying that the health sector is in a national crisis, calling for the president to intervene and ensure that this is dealt with. He describes it as a cancer that has been growing over the years.